Now we will demonstrate to you how to do the tracheostomy care to a patient. So before we do that, we will gather all the necessary equipment that we need. So first we have the trach kit, the normal saline, and I have a doll that will serve as my patient, and I put a temporary or artificial trach so we can use it so I can use it to demonstrate it with you, and his oxygen. So now once I have all the supplies that I need, I'm gonna go to my patient's room, knock the door, introduce myself, and identify if I have the right patient by using their name and date of birth. So once I identify everything, I'm gonna wash my hands. Remember to wash the hands for at least 20 seconds. And then after washing the hands, I'm going to put my patient's head into a semi-Fowler's or into his comfortable position. And after that, I'm going to auscultate my patient's lung field. And now I'm going to prepare my working table. So I will show you on how to prepare my working table. So now we are going to do the step-by-step on how to do the trach care. So first thing we're going to do is to grab this trach kit and then open it. So remember that the tracheostomy care is a sterile procedure. So we will open the trach kit. So we will open it. So inside we have a sterile gloves. So before we touch anything, we want to put the sterile gloves first. So we grab the sterile gloves, and then to open a sterile gloves, we need to make sure that we open the part first away from us. So I'll open, and make sure make sure that we read the label where the cuff end goes. The cuff end must go towards me. So I will open away towards me and open my gloves. So this is the left and the right. So I will use the 1-inch rule to open my sterile gloves. Now so everything now is sterile. So I don't want to contaminate my sterile gloves. So I'm going to use my dominant hand to put the sterile gloves to my non-dominant hand, which is the left is my dominant hand. So I will use my non-dominant hand to put it. So I will grab the inside part, because the inside part is not sterile. So to put it, I will put okay. Once I put it, I don't need to worry fixing right now, because I'm worried right now is to maintain the sterile to sterile. So my dominant hand is now sterile, so I have to put the other glove, my non-dominant hand, to the sterile gloves. So to do that, I will grab the inside part, the outer part of the glove. So let's see, this is sterile to sterile. Just always remember not to touch any of the outside of the gloves, because once you touch it, it's gonna be contaminated and it will not gonna be sterile. So I will put my hands inside. So now I have sterile to sterile, and now I can fix my gloves. So once I fix my gloves, I will take away this one, and I will go to my kit now. So bakit ka nagsalita? So now I put my sterile gloves. Now I will get my drape. So I will open my drape. Always remember that the shiny part will go to down, like shiny part is down. So here now I have my penetrated dressing. I have my steel brush. I have my 4x4 gauze. I have my string, but now we don't use a string anymore. We use velcro. I have my Q-tips, and I have my pipe cleaner, and then I have my 3 compartment. So my dominant hand is sterile, so I will use my contaminated hand to put normal saline to the first compartment, I put normal saline to the 3 compartment as I use my contaminated hands, and I still have my sterile hand. So now I'm going to my patient. So I have my contaminated hands. I loosen up the oxygen because the patient still needs the oxygen, and I'll take out the inner cannula by twisting it or turning it slowly and gently. So now I have my inner cannula out. I will soak it into the first compartment of my tray. So while soaking it, I want to soak it because I want to remove all the secretions that's inside the inner cannula. So we'll leave it there, and we will go back to my patient. So I will go to my patient. So now I will do I will use the Q-tips to clean the inner part of the paste plate. So before that, I will dip the Q-tips so I will dip the Q-tips into the 3rd compartment, and I will clean my patient's paste plate inside by doing front and back, so like that. So after I clean it, I'll set aside the dirty one. Then now we clean the inside of the paste plate. We're going to do is remove the dirt, the soil penetrated dressing, and clean the outside of the stoma, the surroundings, clean the surroundings using another clean Q-tips. Now we clean it already. We want to dry it using the 4x4 gauze. And then once we dry it, we put back the fenestrated dressing to the patient. But we have to we always need to remember that we have to be careful and be gentle to the patient. So now that we clean the patient paste plate, we're going back to the inner cannula. So to clean the inner cannula, we soak it, and then we will get the inner cannula, and we will use steel brush to clean the inner part of the inner cannula to remove necessary secretion inside. And we put it, then we're gonna rinse it to the second compartment by, once we rinse it, we tap it like this, and then we will use the pipe cleaner to clean and dry it inside. So now our inner cannula is clean. We will put it back to the patient, and by putting it back, we want to put it in, turn, then lock slowly, and then we will change the string. But now, as I told you a while ago, we don't use the string, we use velcro. So we will change the velcro, and then we will put the oxygen back to the patient. So we put everything back to the patient. Now I want to clean my working area. So I'm gonna clean my working area. I'll remove my gloves. To remove our gloves, we do it like this. Okay, I'm gonna wash my hands again. After the procedure, I wash my hands, and then I'm gonna go back to my patient, put my patient into his comfortable position, and then ask if he's feeling okay. And after that, I want to auscultate his lungs again before I leave. So once I auscultate his lung and everything is okay, I will give the call bell to my patient and tell them that if he needs anything, or if he needs help, just ring the bell, and then I'll come back for him to check him again. And that's the end of our tracheostomy care.